So what are the things that women can do proactively during perimenopause and continue to do intimate, like we know what to do for our biceps, right? We know
Right.
what to do for our thighs. What do we do for our pelvic floor?
So you start with really basic pelvic floor contractions, like we talked about, almost
Hmm.
like you are postpartum. You start with contractions and lying down, and then bridges, and go into lunges and squatting. But I really encourage women to start using weights, just like they do with their squats and their bicep curls. But you're bringing the pelvic floor contraction into that. So
Hmm.
before you do a bicep curl, you're doing a pelvic floor contraction and then doing the bicep curl. Before you do a squat, you do the Kegel or pelvic floor contraction, and then you do the squat. So you're automatically turning that muscle on and loading it with exercise. And it's an easy way for people to start strengthening their pelvic floor without having to set aside 20 minutes to do a Kegel workout. And it really becomes functional. Like if you're lifting a heavy bag of groceries, you need to be contracting your pelvic floor. If you're lifting your grandkid or a
Or
stroller,
your
you need to
kid
be.
if you're 48 and
Yeah. If your kid, I mean, I have a 7-year-old and I
yeah,
still have to carry him.
yep.
And so, and I'm 5'2". I'm not a, so it's like I still contract my pelvic floor. So I think strengthening is important. The other thing is using our breath to minimize pressure down. And I always say exhale with exertion. So if
Hmm.
you
Okay.
are lifting weights, don't hold your breath. You need to be breathing out. If you're pooping and you're trying to push, you need to be exhaling and pushing out. If you're lifting your kid, exhale as you lift your kid. If you hold your breath or do what we call a Valsalva, that locks all this pressure into your abdomen and pushes down on your pelvic floor. That
That's good
repeatedly will lead
for me
to
to a
weakness.
reminder. I always feel like when I'm doing weights, I do tend to hold my breath on the
Yes, a
exertion
lot of
part.
people do.
Yeah.
And we see it online. And we see weightlifters holding their breath and their
Hmm.
eyeballs pop out and their face gets red. I'm like, okay, that person probably has hemorrhoids. But it's the
Yep.
same thing. It's pressure doesn't know where to go, so it will go to the path of least resistance. And that is often the pelvic floor as we get older. So exhaling with exertion, proactively exercising, walking is huge. You can build pelvic floor strength just through walking. There are studies that show that. Managing constipation and eating good foods, getting enough hydration, having good poop so that you don't have to strain, also important. And then having good bladder habits, not going just in case. Waiting until you have the urge to go. Don't push when you pee. Again, more pressure. Just sit and relax to empty your bladder.
I also see the opposite where, and I feel like I'm talking to my patients about this all the time, especially those who do have frequent UTIs, is like, how long after you notice you need to pee do you wait? And it's like some women just wait until their bladder is so full
Yeah.
that they're just running to the bathroom. So
They're
don't
running to
wait
the
till you're
bathroom.
so over full
Yeah.
either.
The normal range is between 2 to 4 hours.
Hmm.
So if you're going, and I'm guilty of this at work. If we're seeing patients, sometimes I'll go 8 hours, and I'm like, Sarah, you did not go to the bathroom enough,
Yeah.
and my muscles are so tight I can't even start my stream.
Yeah.
And so I think just knowing some of these habits of, going when you have the urge, but don't go too often. Also staying hydrated. As we get older,
Hmm.
sometimes we don't want to leak, so we avoid drinking fluids. And then you get higher concentration of bacteria, you're at risk for a urinary tract infection. So again, just some of these basics to maintain really good pelvic floor health.